This is all about better outcomes. How you tell that story is how you're going to develop that partnership. The hope and motivation that this engenders, that'll get you better outcomes. So let's go back to our anchor slide. How does this inform that personalized evidence-based medicine? The patient's current circumstances are a part of evidence-based medicine. If you tell a story in a way that gives them hope and motivation, you improve their current circumstances, giving you a better chance of achieving better outcomes with them. A word about mediators and language. We think about mediators negatively. Too much or too little of something. That's what the patient has, right? That's how we think about it. Every patient has positive mediators, as you just saw with Helen. She has strengths to rely upon. So let's change this. Mediators and perpetuators are also factors, mental, emotional, or spiritual, that contribute to physiological changes and functional responses to improve the condition and allow the restoration of health. Positive mediators. And the question to ask is another good what or how question. Helen, how did you overcome that previous challenge in your life? What strengths did you draw upon? If you think about it, what do we do as clinicians? The basic question we're asking when we go in that room is, what's wrong with you? That's our career. What's wrong with you? You're a functional medicine clinician now. You're going to go forward in this way with positive mediators. Not what's wrong with you, what's strong with you. Telling the patient's story is the most important skill that's not in your toolkit. And here are your clinical skills, competencies, and milestones for this step. And correlating. Remember to accurately correlate the features of the patient's life with what they're currently experiencing. That will help you get better outcomes in this step. And it's all about informing the order step. Now, the order step, our fourth step, this is to inform how we're going to initiate. And this step is together also. It's a co-prioritizing. As I said in my early career, it was about me telling the patient what they needed to do. The first item here, acknowledge the patient's goals. That's really important. And as we said, the O steps, the second and fourth step, use the matrix. There's other tools that are not in the toolkit. But even though this step uses the matrix, we have to emphasize the timeline. Timeline's changed on you now in this step. The timeline doesn't end at their current age. You need to extend the timeline. Why? To practice the best personalized evidence-based medicine, because you need to understand their preferences and their values, and you need to understand their current circumstances, and we'll see why in a minute. So, the questions to ask every patient to practice the best evidence-based medicine gives you these kinds of answers. What are Helen's current circumstances? She's seen many providers, many specialists. She's exhausted a lot of prescription options and other evidence-based options. She has financial scarcity. She cannot access labs and supplements, nor does she want to use them. She prefers no more pills. Her values are, the main one is relationships. And her goals are to have more energy, to spend more time with her grandchildren, and to have changed mood so she can feel like getting connected again with her friends. The first two steps, gathering and organizing, were to understand the patient's physiological priorities. In tell and order, you're going to come to understand the patient's priorities. Aligning them both will get you better outcomes. If you're only relying on the physiological priorities that you understand and not the patient's priorities, you will never get the best outcomes. And that's a negative way of saying something. As a functional medicine clinician, you're going to rely both on the physiological priorities and the patient's priorities, and you are going to get better outcomes. So in gathering the patient's story, you will understand their physiological priorities, but the patient's priorities are only understood by extending the timeline, understanding their health goals, and you've learned how to take a history. Now you've learned how to gather a story. You need to gather a patient's future. Not just their past, but their future. And the important question to ask is this: what do you want your health for? Now, I need you to stand up, do a very quick stretch, and imagine you're in a different place. Everybody stand up again, arms over your head for one moment. Imagine now you're going back to your office on Monday. Sit down, keep your arms over your head. Sit down, keep your arms over your head Close your eyes. You're in your office. Imagine you're with your least favorite patient. Keep your eyes closed and get in that space. They are in your exam room. You are walking up to the exam room, and you are gathering yourself to get ready for this patient. This is a heart sinker. Your heart sinks every time you see their name on your schedule. Now gather yourself. Get ready to see this patient. But you're going to go in there this time with the intent of understanding what they want their health for, their values, because you haven't asked that question yet. So go in, sit down, exchange a few pleasantries with them. Take a few moments to do that. Keep your eyes closed. And your visit with them is progressing, and now there's an opportune moment to look them in the eyes and ask them, with all the compassion you have, what do you want your health for? Ask that question silently, whisper it to them right now, and listen for 10 seconds for their response. Go ahead, ask that question. Put your right hand over your heart, and put your left hand over your right hand. Over your right hand, and now go forward with that patient. Open your eyes. So that changed my career. That can change your career, and that will change outcomes. We not only gather a history and gather a future, we need to gather the patient's present. This is their current circumstances. Helen, if it would help you to have more energy to play with your grandchildren, to change your mood, to get connected with friends, what would you be able to do? What are your current circumstances, in other words? What would you be able and willing to do to change your sleep, to get more movement in your life, to change what you're eating and drinking, to avoid stress or do something to reduce stress, and to get more connected with people? What are you able to do right now? Those are the questions you want to ask, and then find out what would make it difficult for you to do that, so you're not recommending something they can't do. This is the core list. What can Helen commit to, omit, reduce, or eliminate? Sometimes I just give that on a piece of paper. They put it on their refrigerator, and that keeps them mindful of that until the next appointment. So you'll get better outcomes if you gather not just a history like we used to do. Functional medicine clinicians gather the patient's future, and they gather the patient's present. The physiological priorities and the patient's priorities together. You'll get better patient outcomes. So this is how the order step informs the initiate step. Let's look how this might look. Version E doesn't look very good. It's green pharmacy. Helen, you need some lab tests and supplements. Well, we know she doesn't want that. That's not going to be helpful. You at least need to incorporate the lifestyle factors, change environment, change her behaviors. Lab test supplements, yes, but Helen, let's get you more active. How about walking? How about changing some of the things you eat, a less inflammatory diet? Well, we haven't supported her much, so let's support her with the collaborative care team. Maybe some labs, some supplements, but how about a health coach to help you get into that movement routine and help you stick with it? We've got a nutrition professional. They can help you understand what you need to change and keep you on track and check in with it so you keep those changes going. Okay, so we've still only taken her history into account. Let's take her future into account. What does Helen want her health for? Helen, there's some things that would help you have more energy to play with your grandchildren, help you change your mood to feel like getting connected with your friends. How about walking more? We got a health coach for that. Changing your diet, we got a nutrition professional. But if you sleep better, that's going to change your energy and your mood. How about no screen time after dinner? How about going to bed an hour earlier? How about meditating or relaxing for 15 minutes a day? Just a breathing technique. Find something that the patient used to like to do. Helen used to like to sing in the church choir. Let's get her to rejoin that church choir. Version A. Now we've got her history, her future, and her present taken into account by doing this. Helen, there's many things that would help you to have energy to play with your grandchildren and change your mood to feel like spending more time with your friends. And you don't have to do all of them at once. Just start with a few. What's possible for you right now? What do you think would help you change your sleep and move your body more, change what you're eating, change your response to stress, avoid stress, help you get more connected people? What do you think you can do right now? It's a great list. You don't have to do everything at once. Let's just do what you can do right now to start feeling better. Look at your list, think of what's possible, and we'll call it your core list. Maybe pick one thing to commit to, maybe one to omit, reduce, or eliminate. We'll keep in mind, the reason you're doing this is they will give you more energy. They will help you change your mood. Helen, your assignment is to take out your cell phone in the next month. And every time you connect with your grandchildren or your friends, take a photo. I want to see it next time you come in. We're going to share some good laughs with that when you come in next time. That's what I want to see. So this is A+ evidence-based medicine. It takes all the components of evidence-based medicine into account. Because in gathering the patient's story and using the timeline and the matrix well, we have amplified our clinical experience, we have augmented our clinical judgment. In the way we've told the patient their story, we've improved their circumstances with motivation and hope. In the way that we take their future into account, we are taking into account those preferences and values. That will help us align physiological priorities with their priorities. Their adherence, their compliance, their outcomes with behavior changes are going to be better. In taking the patient's presence into account, we're going to understand what they're capable of doing. That's going to improve outcomes. And the way we extend the timeline will achieve that. And then we'll give you the final version. Helen, there's some lab tests and supplements I could order right now, but you mentioned you're trying to keep costs down and take as few pills as possible. So in my experience, if you first focus on these other areas that you can change, makes the supplements and lab tests unnecessary. How does this approach appeal to you? That works. Confidence. That will work for you on Monday. So there's tools in the toolkit, tools that are not in the toolkit that you're going to incorporate on Monday going forward in your practice. Consider the patient's present and their future as tools that you have not used probably to this point in your practice. You're going to get better outcomes if you use them. The therapeutic partnership is a tool, and these are your clinical skills, competencies, and milestones for this step of Go To It. Do you consistently elicit the patient's health goals and their capacity for change? Fifth step of Go To It, initiating assessment and care, and of course this will inform how you track and how you gather at the next step. And it's not just initiating therapeutic interventions, as this slide shows. It could be diagnostic or prognostic interventions. It could be a referral to another practitioner. So we need to keep that in mind. In terms of tools in the toolkit, this is where we have the most tools. We've got such a plethora of tools. It's really a treasure trove. So get to know this toolkit as we've emphasized over and over this week. And now a little bit of a different twist about the tools in the toolkit and the tools that are not in the toolkit and outcomes. When you use the tools in the toolkit, it will help you become more efficient in your practice. When you use the tools that are not in the toolkit, you will develop practice proficiency. You'll not only get better patient outcomes, you'll get better business outcomes if you combine these two tools effectively. In this step, the initiate step, the key tools we expect you to use now, the diet, nutrition, lifestyle journals, the functional medicine food plans, remember core elimination and cardiometabolic, as well as the functional medicine prescription. You've had in-depth training on this now, and just right before this training you had it, so I'll breeze through these, but just to remind you, a good initial intervention, the elimination diet. You can start to initiate that when you go back to your office. Cardiometabolic food plan, an excellent basic anti-inflammatory food plan for just about any chronic disease. And now to shift gears a bit. Our clinical decision trees is something you'll be exposed to in the advanced practice modules as you move forward in the training. It's where you recognize the clinical patterns around those 7 nodes of the matrix, but we don't expect you to have that skill yet. What we want you to think about is where to start if you don't have to focus on that area of the matrix. And this gets to our third performance objective. There's an optimal sequence of initial interventions for you starting out your practice. It helps ink disappear at the center of the matrix. And we've mentioned now, upstream medicine, this is where you need to focus. Downstream is more those 7 nodes of the matrix, so you don't have to focus on those as you start your functional medicine practice. You may have patients with ink everywhere on all 7 nodes of the matrix, but the optimal sequence of intervention will be this. Focus not on the 7 nodes of the matrix, focus on the antecedents, triggers, mediators, food first, and the base of the matrix, Modifiable lifestyle factors, the roots of the functional medicine tree, and then the gut, as you've heard throughout this training. Start with the gut. And then the fourth step, when you become really proficient and advanced, is to assess, prioritize, and address the imbalances on the matrix. But there's an asterisk there, because if you address these first three things, that often disappears on its own. The ink disappears. So if you think about a matrix full of ink like this, think of it like this. Just focus there. You will be effective. You can black out that part of the matrix for now until you develop further skills and further experience. Because when your Helen comes to you next week with a matrix that looks like this, you can make interventions in the ATMs and the LMFs like that, and she'll come back at her second visit with that much ink disappeared on the 7 nodes of the matrix. If at her second visit, you then make these interventions in the ATMs and the MLFs, she'll come back at her third visit with that much more ink disappeared on the 7 nodes of the matrix. And now you can look at her at that third visit and say, where's the ink? It's in that biotransformation and elimination node. Perhaps there was a toxic exposure we didn't detect, which informed that chemical sensitivity. Maybe it'll show up on our toxic exposure questionnaire. So that's the optimal sequence of interventions to help you make ink disappear on the center of the matrix. Just focus there. The antecedents, triggers, mediators, modifiable lifestyle factors. So time for a workshop. Let's have you stand up again, stretch a little bit if you need to. This is a team intervention again. The person at your table with the most phytonutrient clothing on gets to start. You're going to start using different modifiable lifestyle factors. Go clockwise around the table until you get 2 new lifestyle interventions that you're going to use in your practice to improve sleep, movement, nutrition, relationships, and stress. So just go around the table, start with the person who's the most colorful, and I bet you can do this in 1 minute. What are the modifiable lifestyle factors you're going to use on Monday? Go. Okay. New modifiable lifestyle interventions. Hopefully in this training you will now have new behavioral interventions to introduce with your patient. At this point in your training, you're also wondering, what skill level do I need with lab testing? And as you've heard now, most of my patients, I couldn't use any lab testing. Many of you will be in that same position where your patients don't have access to them. But if you want to focus on lab testing, diagnostic testing, these are the 4 that you should focus on. The stool analysis, the expanded cardiometabolic profile, the expanded thyroid profile, and the adrenal stress profile. But really, your best diagnostic test is the elimination diet with the reintroduction phase. That's your best diagnostic test to focus on. And you can all do that. No cost, no labs, no supplements. All right. These are your competencies and milestones for this test. Work on consistently initiating appropriate dietary and modifiable lifestyle interventions, taking into account the patient's capacity to make those changes. That's your assignment to work on as you go back to your office now. The tracking step is the 6th step here, and of course it informs how you will gather at the next visit and how you will organize again on the matrix at the next visit, because the matrix is a living document, as is the timeline. You're going to populate the timeline in the matrix further at the 2nd visit and at the 3rd visit, and that's why you set up tracking the way you do. So we're not going to spend a lot of time on tracking. We spend a lot of time on this in the advanced practice modules. You do want to remember the medical symptom questionnaire helps you in this step and will help you at that next visit. Body composition tracking, your anthropometrics, and also if you have BIA, the bioimpedance analysis, you can use that. Remember your medical symptom questionnaire, and that is not a validated tool, but there are validated tools such as the patient activation measure, the patient reported outcomes measure, the PROMISE tool if you like to use those as well. And your clinical skills, competencies, and milestones in this step are listed here. So these are milestones you can, again, get to know for the first 3 levels, what you need to learn by the time you take your next advanced practice module, and the 4th, what you want to know for certification. How do you put functional medicine into a nutshell? You've been asked to make an elevator speech earlier in this training. So what's your elevator speech for functional medicine now at the end of our training? And if you haven't recognized it by now, I really love language. Physiology is the language of the body. And if the body has a language, there's a grammar. So there's a grammar of physiology, which means that there are nouns and verbs and adjectives and adverbs of physiology. In 20th century medicine, the strength was component biology. Think how well we could understand and image all the organs and tissues of the body. Think how well we could measure the molecules of the body when we exited the 20th century. These are the things of the body, the nouns of the grammar of physiology. And to complete the language of the body, we need the verbs and the adjectives and the adverbs. That's 21st century medicine. That's our systems biology with functional medicine. Because what are the verbs of the body, the actions, the processes of the body? Those are the 7 nodes of the matrix. Those are the verbs of the body. What changes the meaning of nouns and verbs? Adjectives and adverbs. What changes the functions of organs and the processes of our body? It must be the adjectives and the adverbs of the language of physiology. What are those? The environment. Form follows function, function follows environment. The antecedents, triggers, and mediators, the modifiable lifestyle factors, they are the adjectives and adverbs of the grammar of physiology. They change physiological function, just like adjectives and adverbs change the meaning of nouns and verbs. So we used to look for, in the 20th century, tissues that had issues, right? Organs with problems, did we not? In the 21st century, with the complete language of physiology, we're now going to look for issues, tissues, problems with function that affect the organs. Elevator speeches. I can't just give you one. When we're evaluating patients, it's medicine of root cause analysis. That's a good elevator speech. That's a short elevator ride. When we're intervening, it's medicine that optimizes physiological function. Functional medicine is N of 1 medicine. We address the same means to treat the disease as the means which cause the disease in that individual. If we want to practice the best personalized evidence-based medicine, what your training has been all about is, yes, we want the best population evidence-based medicine from the medical literature. We want to keep that, incorporate that, and we want to now you've learned in this training how to elicit and gather the best individual personalized evidence from the patient, to add that to what you know from the medical literature and the scientific evidence. And this is the description of personalized evidence-based medicine that you've learned. Okay, so let's think about it again in the context of that evidence-based medicine. You're now going to go forward and use your timeline and matrix to gather and organize to amplify your clinical experience, augment your clinical judgment. You're going to tell the patient's story in a way that changes their circumstances, that motivates them. You're going to order and prioritize in a way that you align physiological priorities with their priorities, their preferences and values, their capacity to make changes. And you're going to initiate and track according to the scientific evidence. This is the best evidence-based medicine. Let's reinforce what you've learned in this presentation and in the entire course now with our farewell images. You're going to take the time to learn what's in that toolkit and to start applying it to become a more efficient practitioner. You're going to learn the skills that are not in the toolkit to become more proficient in your practice, and this will help you get better patient outcomes. You're going to do like I did in the first 30 days after my IFMCP. I went on a language elimination diet. I eliminated the word disease and the names of diseases and the verb to have from my language in the first 30 days. I made myself do it and only explain what was going on with the patient in terms of physiological function. I challenge you to go on that elimination diet in the next 30 days. You're going to use positive language. You are expressing a condition, and what's expressed can be silenced, and what is a condition is conditional. You're going to improve your receptive language skills. You're going to change the intent with which you listen to this story. To help you organize on the matrix and to help you elicit that story that you're going to tell. You're going to change the questions that you ask and the way that you ask them, and you're going to start to use a lot of what and how questions. You're not just going to look for the effects and consequences of disease, but the explanatory knowledge, the antecedents, triggers, mediators, modifiable lifestyle factors of disease. And your holy grail is no longer going to be just disease and diagnosis, but physiological dysfunction, because you know that can be reversed and optimized, and that will help you get better outcomes. You're going to be a different kind of detective looking for different kinds of clues, because sometimes you're going to be forced to look for things that are contributory, correlated, causative, and just a preponderance of those because you've run out of medical literature upon which to rely. And you're going to have to turn to the patient to generate the evidence that you need to make a sound decision going forward that has a good chance of helping them with a low risk of harm and a high chance of benefit. You're going to understand you can populate things on many areas of the matrix, and there's no one right way or wrong way to populate the matrix. There's the right way for you to help you tell the story as best you can and to help you order and prioritize as best you can. And you're going to learn to tell that patient's story, the most important skill in functional medicine. And when you're doing it, you're going to correlate those antecedents, triggers, and mediators, the underlying causes, to what they're currently experiencing to help motivate them. And you're going to extend that timeline. Not just gather a history, gather their future, gather their current, their present. You're not going to worry about that center of the matrix yet. You'll watch ink disappear if you just address the outside of the matrix. And your most important tool you're going to keep in mind is you and your patient and the therapeutic relationship that you develop. So we've integrated the 6 steps of Go To It. We've put the pieces of the entire training together. You've got the confidence now to go forward and start this in your practice on Monday. You understand the skill level that you'll need at this stage of your training, and when you start taking the advanced practice modules, and when you apply for certification and become certified. You develop new insights now in this course that you can apply to your patient care. On behalf of the entire staff at IFM, I'd like to thank you for spending this time with us. We look forward to deepening our relationship with you and to seeing you at your next training. Thank you very much.